Good morning, Dr. Deuk with the Deuk Spine Institute. It is October 23rd, 2025. Our patient that's having spine surgery this morning, she comes from New York and she's here with her sister who also had surgery here. And she's been suffering with neck problems, pain in the neck, numbness, weakness, tingling in her arms, particularly the right arm. She has 2 herniated discs, which you can see on the MRI scan at the, bottom of your screen, Henry?
Yep.
Yeah. And that's number 5-6 and number 6-7 that are herniated. We're going to go in and fix them with laser. Now, she was offered fusion surgery by a surgeon in New York, but like many people, she did her research and she found that fusion surgery has really bad outcomes, really bad results. There are a lot of patients who have spinal fusion that are doing far worse after surgery than before. So she wanted a better option, something less invasive, something with more predictable, better results. So she discovered the Deuk laser disc repair. And we're here today to treat her herniated disc in her neck with the Deuk laser disc repair. One of the other things you have to consider, she's female, she's elderly, and if you look carefully at her x-ray, we're going to see in a moment, she does have some mild fractures of the bones in her neck. Okay, why? Because she has osteoporosis. Now, people with osteoporosis, they have weakened bones in their spine and the rest of their body, and those weak bones tend to not fuse properly, and they tend to reject the hardware that's put in them, like screws and rods. So when you try to do a fusion on a patient with osteoporosis, a lot of times the screws just break the bone and rip out of the bone, and the patients don't fuse and they end up with complications. She didn't want complications. She's smart. So she went for a non-fusion treatment. The Deuk laser disc repair is that treatment. But she has a bad neck pain, and Henry, let's show the audience while we're getting into the neck and getting into those discs, let's show the audience the 30 different causes of chronic neck pain. And then we'll talk some more about the surgery we're doing afterwards. I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. All right, welcome back. You can see from our video there are 30 things that cause neck pain, and those 30 things include discs, facets, fractures. She has primarily problems with her disc. That's what's causing her symptoms. She also has fractures, but she also has arthritic facet joints. That said, based on my examination, most of her problems are coming from her discs. So our next step is to get into those discs so we can fix them. We've just given her a little bit more relaxing muscle relaxer to relax the soft tissues in her neck. And then I'm going to try again to access the spine. Shot. 2, 3, 4, 5, 6, 7. Shot. Excellent. Shot. Let's go AP quick. Take a shot now. Right now. All right. A little bit too much to her right. Lateral. Shot. 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 That looks good. AP. Quick AP. Lateral. That's perfect. All right. Well, she has surprisingly a lot of tone in her soft tissues, muscles. 2, 3, 4, 5, 6, 7. Okay, it looks good. Let's get another AP. Go ahead. If you have questions during the surgery and you want me to answer them, feel free to type them up. I'll do my best. Now we're a little bit off to the right. Lateral. A little bit. I'm going to try to bring it back a little. Shot. 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 AP. Injection. That's perfect. We're right in the middle, but we're not over the disc, but we're going to be over the disc in just a moment. Injection here. Knife. That's enough. All right, Henry. Let's show the audience how a disc injury can be so painful for a patient. Guide wire.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. We are shot. Just getting down to the spine. AP. Shot. All right, we're going to have to move back to the midline, lateral, unless you think you're off on that. Shot. Shot. Take that. AP. Don't bother locking it, Jordan. Locking will just waste time. Shot. And remember, when you're rolling it, lateral. Shot. 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 That looks pretty good. AP. Now think about the movement. You got to bring it over. All right. Shot. That's it? Give me a good AP, clean AP. Your best. It's almost good. It's almost perfect. You think that's it right there? Yep. See how I'm in the center now? All right, lateral. Very good. So we're in perfect position on the AP. And now I have to advance the dilator into the disc. That is the 2, 3, 4, 5, 6, 7 disc. Shot. We're going into the disc. I need a pipe cleaner first, Luis. Shot. We're going to do a quick discogram. Shot. Now this patient actually had back problems and neck problems. So we did her back surgery on Tuesday. Doing her neck surgery today. Any questions? Her chest is going up and down and pushing my hand a little bit, so I have to... There's no stopper there. Shot?
Yes, we have a question coming
Sean?
from Faisal on Facebook
Shot?
asking.
That's why we need the stopper, Luis. Where's the rubber stopper? Remember? It goes here. Shot? Go ahead.
Asking, hi doctor,
Shot?
hope you're well. This case will be great to see you curing her pain. What are the signs and symptoms of a failed disc fusion surgery? Thank you.
What are the signs and symptoms of a failed fusion surgery?
Correct.
Well, I guess the most important is pain in your back or neck, pain in your arm or leg, weakness in the arm or leg, numbness in the arm or leg, tingling in the arm or leg, infection. Those are all symptoms. Fevers, drainage. There's lots of symptoms. Shot? Yeah. Too many to name. But you want to look and see how the patient's doing. That's the most important thing. You ask the simple question, how are you doing? And if the answer is, I'm having a lot of problems and pain, then you know the surgery probably didn't work very well. But the truth is, if you ask doctors about fusion, they're going to tell you we don't do fusion to get rid of back pain or neck pain. We do fusion to treat arm weakness, numbness, and tingling, not back pain and neck pain. Fusion is not a surgery done to treat back and neck pain. It actually makes back and neck pain worse after fusion surgery. That's what happens with most doctors, not at Deuk Spine, but with 99% of other doctors, patients' pain is worse after fusion surgery. So you don't get a fusion surgery to treat back and neck pain. Okay? You got to understand why you do a fusion. Fusion's done to treat pinched nerves causing arm pain, leg pain. That's why fusion is the wrong treatment for people with back and neck pain. Sam, I need to see the scope up there. Not that. The behind me.
Oh, they went over there.
Yeah, I want what we normally do. Why are we changing what we're doing? Why am I having such a difficulty seeing here, guys? No, there's something blocking it. Oh, damn it. Got a lot of surgery today. You guys got to be doing things right. Get another scope, Jordan.
I believe it's the camera. It's on the scope.
When is Nikki coming back?
Oh, next week. Yeah.
When did she leave?
She left last Thursday.
I don't remember giving her more than a week off.
That's better. Good. Oh, ready, please. Ready, please. Yeah. Just a little
It's not the focus. It's water getting between the camera and the lens. I've already adjusted the focus. It was perfect.
Thank you.
Let's have the audience watch how we use the laser to treat back and neck pain and eliminate it when it's coming from a disc injury.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debreeds the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. You can see from our animation how the laser is used to precisely, carefully remove herniations from like those right there that you just saw from the back of the disc where they're causing pain and arm symptoms in the neck for the patient. Okay? Remember, you don't need to remove the disc to fix the patient. You need to remove the herniation, and you need to clean the tear. The disc is not the problem. It never was. There's all kinds of misinformation out there. We have a facts page on our website at deukspine.com. You can read about all the facts that are real and true on that page. These are all herniations here. These little white things you're seeing are herniations. And I'm using the liquid coming out of the endoscope to float those things up, get them to come up and out. The problem is many of them are calcified, so they're very dense and they don't want to come up, so they're too heavy. But this is what we target with an ACDF or an artificial disc. We're trying to get to this part of the disc to treat the patient's symptom. 99% of the disc does not cause symptoms. Only this right here that you're seeing, this crack right here, that's the only thing that causes symptoms. And the surgery you're watching is the only surgery in the world that can go in and precisely target the source of symptoms, which is this tear in the back of the disc with the herniation, using a laser. That laser fiber is 0.5 millimeter, 0.5 millimeter. So imagine how precise this is. There is no other surgery in the world that has this kind of precision. Other surgeries are far more barbaric and clumsy. They're not precise. Like ACDF, not precise at all. I've done 1,000 ACDF surgeries in my career. And artificial discs. They just don't work well. She's doing good, Berndes? Any questions, Henry? If there are questions, feel free to bring them up.
Yes, we have another question from Faisal. Once
Oh,
more
wait,
on
right
Facebook.
here is the foramen. She's got pinched nerve symptoms down her right arm. Numbness, tingling, weakness, and it's from right here. This stuff that was in the foramen that you guys saw come out earlier, the little white chunks of herniation. And this is the uncovertebral joint right there. That's the back of it. There's another piece of herniation coming out. All right. Go ahead. Just flip.
Coming from Faisal once more on Facebook asking, Doctor,
Your head
did
is
you
in the way.
use to do nerve root block injections? Why are surgeons asking their patients to have them rather than surgery or before surgery? I'm sure these don't work as they only inject local anesthetic to numb the nerve or outside of it, and the effects are gone quickly as your body absorbs. Are there any dangers and complications that can happen with these injections? Thank you.
Well, nerve root injections are not a treatment. They should not be used as a treatment. If anything, they're a diagnostic test, but they're useless as a diagnostic test. They're no different than rolling some dice on the table and saying, if the dice are 6 or 7 or 8, then I need to do surgery. It's nonsense. Nerve root injections are unnecessary. They should never be done. They're a waste of money. They're a waste of resources, and they are dangerous because the surgeon or doctor doing them can actually damage the patient's spine or nerves while they're doing that procedure. They can also cause infections. So you don't want an infection. You don't want nerve damage. You don't want a spinal fluid leak. All those things are possible with selective nerve blocks. Selective nerve blocks are not a treatment. They're supposed to be used as a test in the past when we thought they were valuable to tell us which nerve is being pinched or affected. But the truth is, when you inject the medicine around that nerve, so they say the L5 nerve, it's going to spread over to the S1 nerve and up to the L4 and up to the L3 and up to the L2, because there's no way to contain the medicine to one nerve. There's a space around the nerve called the epidural space, and that medicine just goes wherever it wants, and it's going to go to many nerves. So it doesn't give you any information at all. Doctors are using it as a way to trick patients into having more invasive treatments. These are bone spurs that I'm removing right here, the white thing. This is herniation and scar tissue from chronic inflammation right there. This patient has symptoms in both arms. Her right arm is worse. This is all scar tissue, the white stuff from the herniation. So it's scar tissue plus herniation. There's pieces of herniation right there. You guys see that, the white thing? That's a mixture of herniation and scar tissue. The scar tissue comes from her body trying to get rid of the herniation, trying to remove it and dissolve it away. We're using its inflammatory system. That's what the inflammatory system does. But it's kind of like the Russian army trying to get rid of the Ukrainian people and take their land. Okay, it's not working. The Russian army comes in, starts destroying everything, cities, buildings, killing people, expecting the enemy to give up. But the enemy here is the herniated disc, and it's never going to give up. It is impossible to get rid of. That's the thing. You see, your body has no ability truly to get rid of it. Okay, it tries, but it fails every time. And instead of getting rid of the herniation, your inflammatory system, hey,
Sam, where are you? Check the irrigation, please.
yeah, pardon, what is it? It cut off because it's empty? Uh-huh. I don't know. Well, we got to fix these problems, Luis. You understand what I'm saying? I need you get with Hector and fix the problem. You understand? All right, there's some more herniation right there. I think she's going to do fantastic.
How much time we have left?
How much time? We got 20 minutes, 15, 20 minutes. This disc is almost finished, but I've still got one more to go. Dr. Berndes wants to go have a Starbucks coffee and an egg bite. Huh? Not Starbucks? What? Huh?
I like the espresso at my house.
Which one?
Espresso at my house in the kitchen.
Oh. Did you have one this morning?
Yeah.
How was it?
Good.
So, yeah, I hope that you guys understand the analogy, all right? The inflammatory system sees this herniation and says, hey, you're not supposed to be there. We don't know what you are. You're foreign. You're not part of this body. We're getting rid of you. So it comes in and starts to release chemicals all over the herniation, trying to shrink it up and dissolve it. But those chemicals just cause pain, and they sensitize the nerve fibers. And then next thing you know, your nerves are firing away, causing all kinds of arm pain and numbness and tingling. All right, there it is. We just got all the pressure off that nerve. I'm happy with that side. With that disc, we gotta do another disc though, okay? Got a little bleeding coming out. Why? Because remember we got rid of those bone spurs? Well, bone spurs have bone marrow. Bone spurs have bone marrow. Bone marrow has red blood cells. That's where they're made. Your red blood cells, white blood cells, platelets are all made inside your bone marrow. And when you start getting bone spurs, you actually make more bone marrow. It's pretty interesting, isn't it? All right, let me have the dilator. Now? Oh, I have it. All right. All right, we'll just tamp that down for a moment. So that's little bit of bone marrow bleeding from removing bone spurs. Very common when you're doing any kind of surgery on a very degenerated disc. That'll stop on its own. All right, let's get the fluoro in. We're going to move on to the next. Yeah, I don't worry about blood pressure as much with cervical because we don't have muscle to hemorrhage into. Now, I still care because I don't want a retropharyngeal hematoma, right? But it won't cause a intramuscular hematoma, which then dissolves over 2 or 3 months, causing pain in the muscle and muscle spasms, right? Because there's no muscles to spasm. But it can cause airway obstruction if you have a retropharyngeal hematoma. All right, let's take a shot. That's it. Look at that. Beautiful. All right, now let's take a look here. We got 2, 3, 4, 5, 6, and 7. So we've just finished 6, 7. We're going to go to 5, 6 next. She's doing really good. She's stable. So what I'm going to do is I'm going to leave the dilator in the disc shot and take out the tube. I can't really see it that well, Jordan. You got to do something about the windowing. Come on. You know better than that, my man. Good. Shot. Take that. Shot. Perfect. Shot. All right, so I'm going to now move up 1 disc. We're going to move up 1 disc. Here we go. Shot. Yeah, keep the blood pressure down. You're fine where you are. 112 is perfect. Systolic. Just don't let it go up. Okay, we're out of the disc. Shot. We're going to move north to the next disc. I've got to make sure I haven't gotten off the midline. You want to stay in the middle as you're moving north. That's the highway there. Yeah, I got off to the right. So things pushed me over to the right. And shot. That's perfect. I'm going to go a little more north and we'll be good. Go ahead and do a lateral. Shot. Any questions as we get this next disc lined up?
Yes, we have a question and
Sean?
a comment. This question is coming from Lanu on YouTube.
AP?
Question
Yes.
for me saying, I saw one of your testimonial videos. A woman mentioned your name, Henry, and I was surprised.
Rachel.
Is she related to you? No. She is not. There's
Shot? Is that it?
no
Great.
family that I have related to has come here yet, but hopefully soon. With my one of my relatives.
Shot?
But given
All
that,
right.
yep.
Lateral. Perfect. Yeah, the reason why Henry gets mentioned is because he's so awesome. And you guys all get to know Henry during these surgeries. Henry bleeds blue and gold, Deuk spine colors. Before I go ahead and enter the next disc, let's just check one more AP. I'm happy with the lateral. I want to make sure I'm still in the middle. Before I start hammering the dilator through the anterior annulus, I want to make sure we're in the middle. That's perfect. Lateral. All right. Shot. Yeah. Shot. Very nice. We'll do a discogram. That way we can get some blue dye staining our degenerated disc. Nucleus. Perfect. We should be able to see a tear in the back of the disc here. That's the posterior annular tear. Shot. Yeah, there it is. Shot. You guys see it? There's the tear. That's
Yes,
the
we do.
herniation right there. You see the herniation? The
Yes, we do.
arrow is showing you the herniation. It's that curvilinear dark mark. That is the herniated disc at C5-C6. So I'm going to make my way to the back of the disc with this dilator, and then I'm going to bring the tube down that we're going to do the whole surgery through this little tube. My taps are very gentle. I know they must bother some people, I'm sure. When you see me hammering a metal spike over someone's spine and their spinal cord, it gets scary. Thanks for keeping that blood pressure under control, Dr. B. Great job. All right, she's doing really good from a hemodynamic standpoint, respiratory, she's fine. We lost probably 10 cc's of blood on this case because of the bone spurs we've taken out. Those are some big bone spurs. But they were pinching her nerve in the foramen. They were trapping a piece of herniation against the nerve. Did you take a shot? You have to take lots of shots here. And I had to remove some of those bone spurs, otherwise I couldn't get the herniation out. So bone spur removal has two purposes. One, get the pressure of the bone spur off the nerve. Number two, get the bone spur to stop holding the herniation down on the nerve. So you gotta, like opening the lid of a jar to get something out. All right, we're in. I've got about 10-15 minutes max, and then we'll be done. If you have questions, feel free to ask them. We are streaming live spine surgery so that you guys can ask me questions and you can watch. Look here. There's the incision. You guys see that? Get some light on here. You guys see the incision?
Yes, we do.
Okay, just so you understand, the tube is 4 millimeters. That's 4 mm. All right, now the next guy we're doing, he's from Michigan? No, Chicago, I apologize. Our next patient is from Chicago. He's got an incision from an ACDF he had done, and it's literally almost 3 inches long. This patient has a 4 millimeter incision, okay? Now, the other thing about this surgery you're watching, the Deuk laser disc repair, it's laser spine surgery, folks. Endoscopic laser spine surgery. But this next patient, when he had his fusion, and he's here now because he's having problems, obviously, related to the fusion. But this next patient had to take narcotic painkillers. Look at the inflammatory tissue, the red stuff right there. You guys see that?
Yes, we do.
That is the source of the pain she's having in her neck. It's inflammation. Inflammation, folks. Turns out inflammation is the cause of a lot of things. Oh, look at that herniation right there. You guys see that?
Yes, we do.
Look at it. That is amazing. That thing right there is a herniation. It's one piece of herniation. Remember, herniations at a disc are not one piece. They're about 25 pieces. This is one of 25. But you can see from the internal diameter of the tube, which is about 2.8 millimeters, that thing is about 3 millimeters wide, right? Oh, here it comes. So I'm trying to get it to come out, but it won't because it's too big. So I'm going to go grab it with my little grabber. Let's show the audience here, Henry. You see this? Little grabbing action going on.
Yes,
right?
we do.
So I'm going to go down to grab that piece of herniation out. Here it comes. I feel it. I got it. There it is. Look at that, folks. There it is. There's the one piece of herniation. Look how big it is. Show them, Luis.
Damn it.
That's 3 millimeters. 3 millimeters. Okay? Thank you. It's all right. No problem. That's why they're disposable. All right. Any questions? That was a big piece of herniation that just came out. I hope her sister is watching over in the waiting room. These two lovely ladies come from New York. They were both told in New York that New York has the best doctors and there's no reason for them to ever go to Florida for surgery, except that New York doesn't have this Deuk laser disc repair, which is the best surgery in the world for fixing a herniated disc. See that piece of herniation that just came out of there? The reason why you're seeing herniations come out with the laser, not even touching, because the laser creates a pulse wave, a shock wave, that literally pushes out pieces of herniation. That's another thing about the laser. Doctors who don't use lasers, they don't know this, but I know it because I've used this laser to repair now over 6,000 discs. Look at that piece of herniation. Oh, it's amazing. Okay, got another piece. By the way, every time your neck starts hurting or your back starts hurting, it's because you just shot out another piece of herniation. You understand? And your body goes through another cycle of inflammation trying to attack it and get rid of it. But you can't. I've got to cut this thing in half. It's too big and it's too densely calcified. You see the gold color on the herniation? Oh, here it comes. Here it comes. Come on, get out of here. I'm floating it up and out. Him and his cousin. There we go. We just got him out. Beautiful. This is the most amazing surgery in the world, folks. Discovered here at Deuk Spine by me 20 years ago. We've been doing this surgery for 20 years. Peer-reviewed, published, FDA approved, not experimental, not investigational. This is amazing surgery. Henry,
Yes, sir.
we could literally blow the lid off of internet content. You realize that? If we start to transcribe my surgeries?
Yeah. Agreed.
I mean, we're doing all the videos, we're doing our testimonials. Heck, why stop there? Let's take all the freaking spine surgeries, thousands of surgeries, and just start putting them to paper, right?
Yeah.
Don't do that yet. Just remind me of it later.
Not a word.
Sick and tired of being second to companies that don't even come close to what we do, you know? All right, there's a bone spur right there. I'm zapping away. Goodbye. That is sitting right above the nerve root. The nerve root is right down there. I don't know if you guys can see it. It's literally right there. The laser's on it. That's the nerve root. You can see it down there. That's what was getting pinched by herniation. And I've gotten all that herniation out of there where the nerve root lives. So now the nerve root can breathe a sigh of relief. Ah, thank you, Dr. Deuk, for that thing was crushing me like an elephant sitting on my chest. All right. There's more nerve root right there. That's the beginning or shoulder. Okay, beautiful. We're almost done. 5 minutes. I'm going to go look around the other side. Any questions?
We have a comment coming from George on YouTube.
George of the jungle?
I believe so.
Friend to you and me?
Saying, hello, I have tried both endoscopic methods to my patients, interdiscal as you do it, and interlaminar plus flethectomy, and without removal of a set joint. Both works.
Oh, wonderful. George, nice to meet you. It sounds like you're a surgeon. Congratulations. Either that or interventional pain management. Welcome to our stream, George. I apologize for the George of the Jungle comment earlier. It was just Whenever I hear George, I just automatically gets me thinking George of the Jungle. If you grew up in the 80s and you watched, was it Curious George or Tarzan? Huh? Oh my gosh, you guys don't know? Silence is killing me.
I watched both.
All right. Type in George of the Jungle, Friend to You and Me. What did that come from? I think it's a cartoon series.
I think that's Curious George.
Was it Curious George? I don't think so. Was it?
It's
No.
not Curious George.
Well, just type it in and you'll see the answer.
One moment.
All right. So thanks for sharing, George.
George of the Jungle is a parody character. Yeah, it came from the show.
What show?
Cartoon classic from 1967.
And the name?
George of the Jungle.
So George of the Jungle is the actual name.
Yeah.
There's a foraminal herniation that was on the left side. Remember, she had symptoms on both sides. So it's not wanting to float up. I got to make it smaller. Glad you're with us, Sam. All right, there's another piece of herniation that came out. I got about 3 minutes. We're just about done. Why don't we show the audience the video that compares our treatment, Deuk laser disc repair, versus all the other treatments out there. Can we do that, Henry?
Copy that.
In the final few minutes of this surgery. I'm Dr. Ara Deuk-Majan, CEO and founder of the Deuk Spine Institute. I'm here to talk to you today about neck pain and its common treatments. Neck pain has different causes. The most common cause of neck pain is a herniated disc. Herniated discs account for about 85% of chronic neck pain. The second most common cause of neck pain that's chronic is the facet joints. There are facet joints on both sides of the spine, left and right. There is one facet joint for every disc. Facet joint pain requires a different kind of treatment targeted at the facet joint itself. For disc pain, which accounts for 85% of neck pain, the best treatment in the world is the Deuk laser disc repair. It is the most advanced treatment that is the safest and has the highest chance of successfully eliminating symptoms. Let's talk for a moment about what's important for patients who are considering treatment for neck pain coming from an injured or damaged disc in their spine. The most important thing for patients, number one, is getting rid of their symptoms. The type of symptoms that disc herniations or disc injuries can cause include neck pain, headaches, and symptoms down the arm, such as weakness, numbness, tingling, or even pain shooting from the neck down into the arm. The symptoms of neck pain include disc herniations, which are the most common cause, and patients want those symptoms gone. That is their number one priority and goal. The second most important goal for most patients is to avoid a complication from the treatment. Medical treatments do have complications, and the more invasive the treatment, the more likely a complication will occur. Complications from surgery, for example, can include blood clots, pneumonia, heart attack, infection, failure of the spine to heal properly after surgery. There can be implant migration or implant failure, adjacent segment disease, and vascular complications such as injury to the blood vessels or nerves in the neck, including the trachea and esophagus. Nobody wants a complication from spine surgery on their neck, so less invasive is typically going to be a better option to avoid those complications. The third thing patients really want when they're looking at treatment options for curing their neck pain is they want a quick recovery. People want to get back to a normal life as quickly as possible. They want to go back to their activities, they want to be active, they want to play sports, and they want to go back to work. And finally, the next thing to consider is long-term results. For example, if you have a treatment today and it works, how long will that treatment last, and will it create additional problems down the road for you? Treatments like spinal fusion that are invasive typically result in the need for additional treatments such as pain management, physical therapy, and possibly additional surgery. We're going to look at each of these individually and go through each of these options individually. So we're going to start with more invasive treatments that are typically recommended for patients with herniated discs or degenerated discs in their neck. The most common treatment recommended around the world is anterior cervical discectomy and fusion. That is a surgical treatment where the entire disc is removed surgically through a large incision that is very risky. There's bleeding associated and risk of injury to surrounding structures such as the esophagus, trachea, and blood vessels in your neck. Complications are very common with this type of surgery. The complication rate is accepted at 48%, which is a very high number. So if you're considering ACDF or anterior cervical decompression and fusion, you are looking at a very high complication rate. The success rate of this surgery at eliminating neck pain is very low. It's somewhere on the order of 25%. That is the generally accepted success rate at eliminating neck pain. An additional treatment that you can consider is artificial discs. Artificial discs are very similar to ACDF. The difference is instead of fusing two bones together with a metal plate and a cage, we're actually putting in a mobile disc made out of metal and plastic that moves. The problem with the movement is that these discs do pop out of the disc space. Over time, they can fail. They can cause collapse of the vertebral body above and below through fracturing, especially in patients with weak bones such as osteopenia or osteoporosis. Those types of patients are at high risk for complications from both ACDF and artificial discs. Another complication from artificial discs is that you can develop facet joint pain and adjacent segment disease. Very common with artificial discs and fusion, and they typically have the same rate of adjacent segment disease. There's also a long recovery associated with both ACDF and artificial discs. Recovery can take months to years, if recovery even happens at all. There's tremendous scarring in the wound associated with ACDF and artificial discs. Lots of scar tissue, lots of pain, and lots of problems after these surgeries that are invasive. Alternative treatment would be to go in the back of the neck and do a cervical laminectomy and fusion. Again, large incision, high chance of complications, very long recovery, taking years to recover. All three of these types of surgeries, ACDF, artificial discs, and posterior cervical laminectomy and fusion, require the use of postoperative narcotic painkillers. Narcotic painkillers are opioids. They are dangerous. People get addicted to them, they can be abused, and people can overdose. It's easy to overdose on narcotics because you want to keep taking them to treat the severe pain you're going to have after these invasive type surgeries. The severe pain can last weeks or even months, and the addiction can happen very quickly. Let's move into less invasive treatments such as epidural steroid injections. This is a treatment commonly recommended by pain management doctors. They stick a needle into your spine and inject the steroid medicine to reduce inflammation. While this treatment can be effective at temporarily giving you relief for a few days or even a few weeks, the pain always comes back from a herniated disc because the source of pain is never being treated. The annular tear and inflammation within the annular tear is not treated by an epidural steroid injection. The steroid goes throughout your body and causes systemic side effects such as high blood pressure, elevated blood sugar. In patients with diabetes, this could put your sugar up into the 300s and 400s, which is very dangerous for patients. So steroids should be avoided as much as possible. Next, let's turn to spinal cord stimulators. The problem with spinal cord stimulators is they are highly invasive and they are frequently put into patients by untrained doctors who are not surgeons. These doctors are typically pain management specialists, and they're putting these stimulators in patients not because they can cure your pain, but because it's another treatment that they have up their sleeves. These treatments with stimulators pay these doctors obscene amounts of money. The profit for the doctor can be in the tens of thousands of dollars. Avoid spinal cord stimulators. They do not work, they're dangerous, they put you at tremendous risk, and in the end, basically you're taking this device, sticking it on top of your spinal cord and putting a pacemaker under your skin that you're gonna have to live with for the rest of your life. They cause scar tissue and they frequently migrate and get out of position. Next, we're going to talk about physical therapy. While physical therapy has many benefits, such as keeping you toned and fit while you're struggling through the pain and trying to stay mobile, but physical therapy will never, ever cure pain in the neck from a herniated disc. It will just try to keep you active and from getting more and more sedentary and developing deconditioning of your muscles because you're sitting around because you have neck pain all the time. Finally, let's talk about the Deuk laser disc repair. The Deuk laser disc repair is the solution for neck pain. If you have a herniated, bulging disc, extruded, ruptured disc, protruded disc, or degenerated disc, the Deuk laser disc repair works by minimally invasive treatment going to the back of the disc where the problem is coming from. This is the tear in the back of the disc that has inflammation, and using a laser that is extremely precise. The laser fiber itself is 0.5 millimeter or half a millimeter wide, and the endoscope allows me to see 1/20th of a millimeter. I can directly see the nerves and spinal cord. It is an extremely safe treatment. As far as results go, the Deuk laser disc repair has the highest success rate of all the treatments we've discussed so far. We have a 99% cure rate of neck pain coming from herniated discs, and the Deuk laser disc repair has 0 surgical complications to date. Our patients have an immediate recovery. In 1 hour, they're leaving our facility and they're going back to their hotel room. They usually drive themselves in the next morning for a quick checkup, and then it's back to a normal life. Well, I've enjoyed talking to you, and thanks for taking the time to listen to our video. I'm Dr. Ara Deuk-Majin. We'll also find this on our podcast at Deuk Spine Institute Podcast. Thank you. I'm Dr. Deuk-Majin here at the Deuk Spine Institute with a patient who traveled here from Colorado with her husband, and she underwent the cervical Deuk laser disc repair for 2 herniated discs in her neck. And how are you feeling today?
Great. Even on the way home, I felt all the pain released from my arms and my shoulders. I didn't realize how much pain I was actually in. So my arms just feel light. And sitting in the waiting room here earlier, I realized my neck is not hurting at all and my headache is gone.
So your headaches are gone, your neck pain's gone, and your arms are starting to feel normal again.
Yeah, yes.
Amazing, isn't it?
Yes, so amazing. I'm so grateful.
Yeah. Tell me what life was like for you before you came to Deuk Spine Institute. And hello, everybody. It's been a while since I've come talk to you after surgery. Normally, we just play a testimonial and we're done. But I had a few minutes, so I wanted to come and answer questions. And Henry says we have a question or two, so I'll take your questions right now and answer them directly. But this lady we just did, we went through the front of her neck, we went through the disc, we used a tiny tube called a tubular retractor. I brought an endoscope in. The endoscope has light, magnification, irrigation. It has a port that I can place a laser fiber in, and also metal grabbers to remove big pieces of herniation. So that's what we did. We went in there and basically took care of the herniation in the back of 2 discs, number 5-6 and number 6-7, C5-C6, C6-C7, the 2 most common discs in the neck to be damaged and cause symptomatic herniated discs, therefore necessitating treatment. And the treatments that people are offered these days, there's lots of them: medication, therapy, chiropractor, cupping, acupuncture, massage. The list goes on and on and on. It's as long as my arm. PRP, stem cells, disc seal. But in my experience, none of them work, and they only give you at most temporary relief. The only surgeries that work for herniated disc that's causing symptoms are: number 1, spinal decompression and fusion, which is ACDF. Number 2, remove the disc and put an artificial disc. Or number 3, endoscopic surgery. Now, some surgeons would say foraminotomy works too, but foraminotomy doesn't work and it doesn't last, and it causes a destabilization of that segment because the surgeon has to drill away a normal joint called the facet joint to open up the foramen and get the herniation out. And even then, they can't get the herniation out well because the herniation is in front of the nerve root. They have to go past the nerve root or spinal cord, and patients end up with injuries to the nerve root, spinal cord, or dura, causing a spinal fluid leak. So it's best to avoid that type of surgery called foraminotomy or laminectomy if you can. The best treatment for herniated discs in the neck is the endoscopic Deuk laser disc repair. You just watched it done. It's done with a 4mm incision, tiny. There is no downtime. There's no lost work. You can go back to work the next day. You can drive a car the next day. You can go back to most activities with some restrictions the next day, just some lifting restrictions and no contact sports for 1 year. That said, we've been doing this surgery 20 years. We've published it multiple times in the literature. It's been peer-reviewed and published and accepted. It is the standard of care as a treatment for herniated disc. Now, patients who do this surgery don't need painkillers afterwards. They literally take a Tylenol that night of surgery and they're done. Some people will take a muscle relaxer called Robaxin, but no narcotics are needed. If you go out and have a fusion done, like this, where you get a metal plate bolted to your spine, you better believe it, you're going to need narcotic painkillers. Narcotics are dangerous. Opioid pain medication is obviously well established to cause all kinds of problems for patients, including dependence. And of course, you get tolerance where you have to take escalating doses, higher doses in order to control the pain. And of course, some people go into respiratory failure and stop breathing and die because of the opioids. So they're dangerous, addictive drugs. They have a high potential for abuse. We all know that. We want to get away from opioids, not use them if we can avoid it. And the Deuk laser disc repair, you just watched it. That surgery allows you not to have narcotics or opioids after surgery. But if you have artificial disc or fusion, you're going to need them for a long time afterwards. All right, question.
Coming from Lanu, once more on YouTube, asking, there are some mental crises in many hospitals affecting nurses and doctors lately. Have you noticed these in Florida's hospitals?
Well, Lonnie, is that our last question?
Mm-hmm.
All right. Do you want to break off for a minute while I answer it?
Yeah.
All right.
I'll be right back.
So thanks, Lanu, for asking the question. Lanu's question is a great question. She's saying that she senses through news that there is a crisis brewing in the United States in our hospitals that affect doctors, nurses, and ultimately patients will be affected. Lanu is correct. There has been a crisis brewing in America and worldwide for the last 40 years. That crisis is brewing because of one thing and one thing only: the insurance industry. The health insurance industry is the root cause of this crisis. The insurance industry basically denies payment or coverage. We call it coverage in America. They're denying coverage or payment for medical treatments and tests that doctors and nurses are recommending for the patients to have. Now, the reason insurance companies deny these treatments is one reason only. They are greedy. They want to keep that money for themselves. The way insurance works is we all pay insurance companies no matter whether we use insurance or not. Everybody pays them. Now the insurance companies get to keep that money in their bank, and they get to keep it as profit if they don't pay medical claims. So what the insurance companies have done is they've changed the laws on the federal level, they've changed the laws on the state levels so that they cannot pay medical bills, that they could deny payment for doctors and hospitals and nurses' services. They can deny it. They can deny paying for drugs. They can deny paying for medication, x-rays, MRIs, CAT scans, emergency surgeries, life-saving surgeries. It doesn't matter what it is, they deny payments. As a matter of fact, the Wall Street Journal published this year in 2025, in February 12th, that there were 850 million denial of payment by health insurance companies in America last year in 2024. And I promise you, if it's happening in America, it's happening all over the globe, in every country. I know it's happening because I know what's going on in other countries. I have patients from other countries like Europe, like Australia, like Asia, and they all say the same thing. They cannot get the doctor recommended treatment to be covered. Now, here's what happens. When doctors recommend a treatment to be covered and the insurance companies say no, the insurance companies look at that doctor and they say, what did you order? Surgery? We're not covering it. They make a note of that in their computer database. They remember that doctor ordered that surgery that they don't want to pay for. So if that doctor keeps ordering that surgery or that nurse keeps recommending that treatment or drug for the patient, guess what? They cut the ties with that doctor. They kick that doctor out of their network, okay? And the way they do that these days is they are now basically consolidating all the power to the hospitals. They're getting rid of private practice doctors. In America, we had 90% of doctors were individual private practice. They owned their own practice. They had control of how they cared for their patients, what they recommended, what they did. It was a doctor-patient relationship. Now, fast forward 40 years later, 90% of doctors are owned and employed by hospitals. Now, the hospitals are owned and controlled basically by the insurance industry. You see, the insurance industry has consolidated all the doctors from private practice to become employed by the hospital. And now the insurance industry controls everything the hospital does through what's called the electronic medical record system. The insurance companies have access to the hospital's electronic medical record system, and they can look and see who's ordering what, who's ordering too many tests, who's trying to take care of the patients, and they can make the hospital, they can deny the payments for that doctor, they can contact the hospital's administration and say, this doctor is a problem, get rid of him or her. And what happens is if there's a doctor who's advocating for patient care, wants to help the patients, wants to make patients comfortable, wants to make patients well, and they're ordering these tests and the insurance doesn't want to cover it, they will get the hospital to fire that doctor, kick them out of their network. Otherwise, they'll threaten to kick the hospital out of their network with the insurance company and not pay them. So this is what's happening every day here in America, and it's getting worse and worse and worse every day. So doctors are losing autonomy, nurses are losing autonomy, nurses are under the threat now of being replaced by AI. Yeah, it's a bad situation. There's a lot of unhappiness by everybody except for the insurance companies, and they're making gazillions and billions of dollars profits every year, and it keeps going up. Now, they're not reporting these profits to our government because they're diverting the profits out overseas to companies that are located in Ireland or the Caribbean or other places that don't have to report their profits and earnings to the American government. So we call these subsidiary companies. So the insurance industry is basically funneling billions of dollars out of America to small countries that they have chummy relationship with the government auditors so that the government doesn't audit and tax them, and they're basically stealing money out of our country, out of our healthcare system. The other people that are brazenly stealing money out of our healthcare system are the electronic medical record companies. They are charging hospitals and doctors billions of dollars to put in a software into their practice, just to a database basically, that's a searchable database for patient information. It is obscenely ridiculous how much money we're spending on electronic medical records instead of patient care. Hospitals that pay billions of dollars for electronic medical record system could be spending that billions of dollars taking care of nurses and patients and staff, hiring more respiratory therapists, more physical therapists, more anesthesiologists. Instead, hospitals are struggling to make their budget because they're spending so much money on things like that they shouldn't be spending on, like electronic medical record system. We're a broken system. It's only going to get worse. But Deuk Spine Institute doesn't play these games. We don't do what the insurance companies want us to do. We do what's best for our patient. That's why we stand out. But we struggle because of it financially. We need money in order to stay in business. We don't get it from the insurance company. They deny our payments. They won't pay our bills. They just keep rejecting it, throwing it in the garbage. So we're basically trying to suffocate us out of business. But we're not going anywhere as long as we have patient support. We're going to continue to take care of people and do what's right for patients. Any other questions?
That's it for questions.
We'll be back shortly. Our next patient is having neck pain. We're going to do the facet joints first with the Deuk plasma rhizotomy. Then we're going to flip him over. We're going to do a disc. He's already had a fusion. He's fused from C3 all the way down to C6. He only has one disc left at the bottom. It's already herniated. I got to try to get in there and fix that. That's going to be really hard. This is going to be one of the hardest cases I've ever done, this next case. But the back part will be easy. The front part will be very hard. So let's just pray that it goes well. Nice talking to you. And we'll see you guys back shortly for our next surgery.